I really do have good news. Our numbers are going down, and so therefore I'm going to just do this quickly. Our first slide, I decided to change it up a little bit, and instead of the one that shows you the number of cases, I decided to do the one showing the deaths, because there's a lot of communication in the news and so forth that yes, our numbers are going down. This top line is a summary of what's going on in the United States. So you do see the numbers of cases kind of plateauing and then coming on a curve going down. However, the number of deaths have gone up nationwide, and that is this little peak that we see here. Our vaccination rate is pretty much stagnant. We see that we got 80% of people vaccinated with one vaccine only, but the fully vaccinated is still down at 67.4. And we are in the very high community transmission. It's off the charts in terms of the numbers that were supposed to be on that scale. It's kind of like the hurricanes. We need a new scale for these types of pandemics. So I just wanted to show you that. I think this is just something that is catching up with the high number of cases that we had before. Remember, the deaths follow like 2 weeks. So I think we will start seeing those deaths going down. Now, that's very different from what we have here in Palm Beach County, so let's concentrate on what we have here. We are seeing the Omicron now at 99%, so everything that's out there is Omicron, and so we have to take that into account when we talk about therapies and monoclonals. The FDA yesterday put a new announcement and new guidelines. You can read that. It's very specific for the combinations, monoclonal therapies that are no longer to be used in the United States. Our numbers here, this is what Ed Chase gives to you. You can see, just to compare where we were and where we are now, back in November when we were in the yellow, and all the way down to moderate, we were at 2.3% daily case positivities with a population, the transmissible rate for the community transmission was at 48 patients per 100,000. We are now at 1,013 cases per 100,000. So as you can see,
I'll do your slides.
oh, I'm so sorry. See, I'm trying to do it quick. So you can see here that this is where we were back in November, right? 48 per 100,000. And this is where we are now, even though this is coming down very fast. All right, so maybe for February we'll get that down to the yellow, but right now the entire United States is very, very high at this transmission rate. And our positivity, 24.8, where we needed to be below 5 to have any chance of going back down. So, and the same numbers are for Florida. Now, if you look at Miami and Dade, they're even higher than this. So the transmission in the community is still very, very high. So to show you this in terms of our numbers, maybe a graph is worth 1,000 words. You can see that the green is the numbers for 22, way higher than anything that we've ever had before, including last year. This is where we were in 21. So just to give you a perspective of the number of cases. Luckily, we prepared for that. We were ready for it, and so we've been able to handle the number of cases and the reporting. So here is our cases per week. You can see that our peak reached at the end of December, which makes perfect sense. That had to do with the holidays, the Thanksgiving and the Christmas and the traveling and everything else. And then we were waiting for the what would happen for the New Year's Eve, right? We were waiting to see what would happen if we'd have another peak as a result of that, and we did not. People here in Palm Beach County really pretty much stayed home for New Year's Eve. There wasn't a lot of outside, although we partied a lot in the street and threw a lot of fireworks, but people behaved pretty good, and so we did not have that peak occur here in Palm Beach County, and our numbers started coming down, and now we have almost the same kind of very steep cases going down to 33 3,351 cases for our last week ending on January 27. Similarly, I showed you this last time that showed our number of cases that had gone up, but all along our number of deaths had remained low, right? And we had talked about this nationally, that the hospitals were not filling up here in Florida, that we were doing well, our hospitals were calm. And so this is just an increase, so you can see it by day. We had our peak here on January, around January 12th, where it peaked with 11 cases for that day. And then it has steadily been going down, where we had 2 and 3 cases the last few days. Now, keep in mind that all these numbers will change. Why? You remember from our last conversations that the deaths get put in the day of death. So as we go forward, these numbers may look more like these, but still, it's a downward trend. And so that is good for us. And Mary will speak about the hospital, since they had the conversations with them specifically. The last thing I want to show you is our immunizations, telling you why we are now in an endemic situation, and we will be in this endemic situation for this reason. Right here you have the numbers of people who have been vaccinated, completely vaccinated. This is the numbers that we have to have, right? We want people to be completely vaccinated and boosted. So for the 60 to 79 age group, this in yellow, they're above 80%. So they are very safe. Unfortunately, these are not the ones going out into the community and spreading it. So this group who is going out is still in the very low numbers. We have only been able to increase these top numbers, the 5 to 9 and the 10 to 11. Last time I showed you this, the 10 to 11 were a 2% increase, and we have a 1% increase for the 5 to 9 and 10 to 11. We are doing everything we can to continue to provide those vaccines for that young age group. And of course, under 5, they cannot get vaccinated. So that remains something that we're going to continue to see for months to come. And so that is why we have to, not be afraid of this thing, but we have to take precautions. We have to take care of one another and continue to do what we're doing in terms of watching and making sure that everybody stays safe, and just learn how to live in a pandemic instead of, being alarmed all the time. We got to let the fear come down so that we can remain doing our jobs and doing what we have to do and carrying on with what we're doing every day. So that's my presentation. I'll let Mary take over.
Before Mary takes over, Doctor, can you just clarify, and I know you alluded to it, that there's been a change with respect to the monoclonal antibodies being withdrawn as far as emergency use authorization, so that it's not going to be available for our residents at this point. Can you just clarify that?
Yes, there are. You need to go, it's the FDA COVID update that the FDA announced yesterday. I don't want to get into all the names and everything because it's very specific. They're combination therapies that are having. We have to look and see what we have here and make sure that people are still, they're not going to give us, they're not going to be giving the therapy that's not approved. So they will make their changes accordingly so that people can get treated with the right monoclonal therapy. Remember, these are man-made antibodies, and so if they don't work against the Omicron, it doesn't make any sense getting it. Now, if you have the Delta and you still switch to these new combinations that do work, they're going to work against the Delta. So it's not like you're going to give up. If you happen to have, if you're in that 1% or less than 0.5%, and you do have the Delta, these will still work. These work on all of them. So that's the idea.
When someone goes to get a test right now, they're not being told anything other than they have COVID. They're not being told you have Omicron or Delta.
That's correct.
So there's no way for them to know whether they would be getting the benefits of the monoclonal at this point?
The monoclonals work on all of them. So yes, if you are in a high-risk category, you should go get your monoclonal therapy to avoid going into the hospital and or dying, right? So that makes sense. The therapy works that way. So
Okay.
don't worry, it's Omicron. 99.5% of everything out there right now is Omicron. So even if it's Delta or even if it's something else, they all work against it. So anybody who is high risk should get the monoclonal as a prevention.
Thank you. Ms. Blakeney, you're up.
Good morning, Mayor, Vice Mayor, Commissioners, Administrator Baker. I'm going to quickly go through some of our COVID data that we've been maintaining and just give you some highlights of some additional activities we've done here within the county. The first graph is the total positivity rate. The upper right graph shows the overall positivity rate, which is at 24.9%, which is the highest positivity rate we've had since COVID began. The lower left-hand graph indicates the positivity rate over the last 2 months of testing. As we go into the weekly positivity rate, as Dr. Alonso talked about, we are currently at 24.8%, which has dropped 2 weeks in a row. The all-time high was 34%. As we talk about the deaths, as Dr. Alonso alluded to, the graph in the upper right shows our overall deaths in Palm Beach County, and the lower left graph shows the death over the past 6 months. Our current death rate in Palm Beach County stands at 1.71%. Regarding daily med alerts, this is a representative countywide sample from Palm Beach County Fire Rescue of individuals that call 911 with COVID-like symptoms. As you can see by the chart in the lower left corner, the med alerts have decreased for the past 2 weeks. This past week, the average was more than 9 patients per day. This is down from the all-time high back on August 14th, where they were seeing 33 patients a day. Regarding our COVID-19 advancements, the emergency management team and the county staff continue to work closely with Dr. Alonso and her staff, our state peers, and various community partners to get resources into our community. Through this collaboration, we've expanded, and I'll share a little more on that, the monoclonal therapy treatment sites, testing locations, and continue to make vaccinations readily available. In addition to the increase in resources, we maintain communication with our hospital CEOs. We recently had a call and received very good feedback on their current situation and improvements that they are seeing. When we talk about the monoclonal sites, with the most recent surge, we were reached out to by the state on December 31st and asked if we could identify a second site to administer the therapy. But with a limited supply, the site did not open until Tuesday, January 18th. As you all are aware, last night we received word from the state late that the Food and Drug Administration revised the emergency use authority for monoclonal antibodies and is no longer allows our providers to administer these treatments in the United States. Due to this decision, all monoclonal sites statewide have been closed temporarily, and all individual appointments that were scheduled, all of those individuals have been contacted by the state that their appointment has been canceled. Regarding COVID-19 home test kits, in an effort to alleviate long lines at the testing locations, on Friday and Saturday, January 7th and 8th, several county departments and their staff, along with 3 of our municipal partners, supported the establishment of 8 geographically located points of distribution. During the 2-day operation, more than 41,000 at-home kits were distributed. These kits were provided to the county by the state. During the distribution of these kits, we did experience a reduction in traffic at the freestanding testing locations. The following week, the state also conducted a mass delivery of test kits to 274 assisted living facilities and nursing homes within the county. Our Public Affairs Department continues to maintain the list of resources on our county website where residents can go for vaccines and testing. Most of these sites are open 7 days a week for both testing and vaccinations. This past week, the federal government announced every home in the U.S. is eligible to order 4 free at-home COVID-19 tests by visiting covidtests.gov. We have vaccinated over 1,059,000 people in Palm Beach County, which represents 75% of our 5-year and older population. We continue to encourage individuals to get vaccinated while wearing a mask, washing our hands, and watching our distance. That concludes my report.
Thank you very much. And I'm not seeing any red lights. You guys have obviously covered this, and we appreciate it. Commissioner McKinley, you've made me a liar.
You moved faster than my coffee allowed me to move. I have just a couple of questions for Dr. Alonso. Dr. Alonso, when I look at your Palm Beach County immunizations rates by ages, I'm a little surprised to see that our, I like to call them our super seniors, the 85-plus population has such a low number.
That's because many of them are in long-term care facilities and really unable to do it on their own, and have difficulties perhaps getting around and getting to places. We do take calls and help people who need assistance in getting to a site, okay? But a lot of them, because they are at home and they're not moving around, they're not going anywhere, just haven't gone for vaccinations. But
Okay.
a lot of those that are not vaccinated are actually in long-term care facilities. So we're urging the long-term care facilities to vaccinate, vaccinate, vaccinate.
Okay, thank you. And then just a couple of questions in terms of protocol. Let's say you were not vaccinated and you ended up catching this latest variant. How long after you've recovered from COVID should you begin your immunizations?
You can actually begin it immediately. There's no contradiction. However, you do have at least a few months of immunity from your own natural immunity. So most people like to wait at least a few months if they decide to get it. Others, after having the scare, go ahead and get vaccinated right away. So it's up to the individual. There's no contraindication of getting vaccinated right away.
And how about the booster?
The booster is at 6 months.
6 months after you've had COVID?
Oh, same thing for the booster. No, I thought you meant if you got vaccinated, then you'd have to wait 6 months to get your booster.
Okay, and then my last is just a comment. I just want to say thank you. I get the weekly updates on your continued efforts to reach out to our farm workers, so thank you for keeping that up.
Thank you.
Thank you, Commissioner. Vice Mayor Weiss.
Good morning, Dr. Alonso. Thanks for the presentation. Thank you, Ms. Blakeney, as well. Question regarding, I guess there's another variant now. I think it's called BA.2, and that's circulating. I guess a number of countries are reporting it. It has also been found in the United States. Any sense of will that reinfect people who had Omicron? Would they then be susceptible to this other variant, or do we know anything
Yes.
really about it?
Yes, everyone's susceptible to all the different variants, and there's many more variants that are circulating. And remember, we don't know what we don't test for, right? But what is done with every single variant that has occurred is that the World Health Organization declares them, whether they're of interest or not, based on how they react, based on their testing that they do on them. The first thing that they do is they test to make sure that the vaccine is still effective on them. And then at that point, the CDC then either follows suit or does not follow suit. There have been several variants, so we have decided that are not promulgating here in the United States, and they have not become even variants of interest. So it's up to the CDC when they do their sequencing and their testing to see how much is around. So it's not uncommon for there to be variants that we don't even know are around. Because remember, when you get tested, they're just testing to see the protein. They're just testing, a rapid test only tests the protein spikes. And the PCR goes and tests the genetic material inside the virus, right? So that's all it's testing for. It's not testing to see if it's a variant or not. For that, you have to send it to special labs to do sequencing. That's when they find out if it's a variant or not. And that's not done all the time, and it's not done routinely at all. So it's when the CDC is specifically looking for. Now, the fact that they've reported it, then we know they have their eye on it, and we wait to see what it takes. As you saw with the Omicron, it took several weeks and a lot of news coverage and a lot of things because it was spreading so quickly, right? But it takes time for them to do all that testing and find out whether or not it's going to be of interest in the sense of how it will spread and how it will affect us.